Aaron M. Moore was Durham's first black doctor. He co-founded North Carolina Mutual Life Insurance and served as its president. Moore helped establish a hospital, a drug company, and a library, and was a community advocate. Manasseh T. Pope was a Spanish-American war veteran, a pioneering physician, and an entrepreneur. Battling segregation, he became one of only 7 black men in Raleigh legally entitled to vote. John T. Williams was among North Carolina's first 3 licensed black doctors. He ascended from slavery's shadow to become an esteemed surgeon, a civic leader, and a U.S. consul. Their contributions continue to resonate in communities today. What do they have in common? The impact of these and other black healthcare professionals is rooted in Leonard Medical School. Established in Raleigh, North Carolina in 1880, the school played a pivotal role in training black physicians. This video explores the history of Leonard Medical School and the profound impact it had. I'm Terry Price, and I have always enjoyed traveling and exploring little-known or forgotten history that's captured on highway historical markers. It's not just another roadside attraction. It's local history, and it's fascinating. The history of American medicine is intricately intertwined with racial and access issues, especially during the Jim Crow era. Segregated healthcare systems denied Black Americans equal medical education and care. Leonard Medical School at Shaw University in Raleigh, North Carolina, emerged to address that pressing need. But before exploring Leonard Medical School's story, we need to grasp the history of medical education for Black Americans. Before the Civil War, they had few opportunities for medical training, often studying abroad or apprenticing with supportive white doctors. Reconstruction offered a brief ray of hope. Institutions like Howard University College of Medicine and Meharry Medical College, which were supported by the Freedmen's Aid Society of the Methodist Episcopal Church, the American Missionary Association, and other philanthropic organizations, were established to cater to black students. By the close of the 19th century, at least a dozen such schools had been established. However, the withdrawal of federal troops and the rise of Jim Crow laws hampered progress. In the aftermath of Reconstruction, the Southern states reinstated elements of the Black Codes through what became known as Jim Crow laws. These laws endured for nearly a century until their abolition with the enactment of the Civil Rights Act of 1964. Before Leonard Medical School, communities of color in North Carolina faced a grim medical landscape worsened by the Civil War's socio-economic aftermath. This led to higher rates of infant and maternal mortality and shorter life expectancies compared to their white counterparts. Despite there being medical schools for white students, none accepted black students. Leonard Medical School's establishment in 1880 aimed to provide accessible medical education to address these healthcare disparities. The school transformed the medical landscape for African American communities by providing accessible education, one of the first in the South to do so. The school not only provided unprecedented educational opportunities, but also catalyzed a surge in the number of black physicians, enhancing healthcare access and public health outcomes. For instance, Lawson Andrew Scruggs, Aaron McDuffie Moore, John T. Williams, and Manasseh Thomas Pope established hospitals and medical societies. The school's establishment of a 4-year curriculum and graduating its first class in 1886 showcased its dedication to medical education. The early 20th century brought new challenges, notably the Flexner Report of 1910, which criticized American medical education. The publication presented a scathing critique of American medical education, highlighting inadequate facilities, outdated curricula, and a lack of qualified faculty in many institutions.
Of the 7 medical schools for Negroes in the United States, 5 are at this moment in no position to make any contribution of value to the solution of the problem above. Flint at New Orleans, Leonard at Raleigh, the Knoxville, Memphis, and Louisville schools are ineffectual.
Following the report, there was a decline in the number of black physicians, contrasting with a surge in white physicians. Financial constraints and inadequate funding hindered Leonard Medical School's ability to comply with the report's mandates, reflecting broader societal disparities. Leonard Medical School depended on donations. This made it hard to afford necessary improvements, leading to its closure sometime around 1918. The closure represented a significant setback for black medical education in the United States. Even after its closure, Leonard Medical School's legacy lived on through nearly 400 pioneering black physicians who addressed healthcare disparities and challenged racial stereotypes. The school's commitment to quality education set a high standard for black medical education, inspiring future generations of healthcare professionals. Leonard Medical School's story reflects the struggles and triumphs of black healthcare professionals amidst racial segregation. While systemic racism persists within the American healthcare system, the legacy of Leonard Medical School underscores the importance of increasing diversity and inclusivity in medical education. Institutions like Leonard Medical School played a crucial role in addressing healthcare disparities, emphasizing the ongoing importance of supporting and expanding access to medical education for underrepresented groups.